Rainforests cover just about 6% of the Earth's surface, but they are home to around 50% of the world's plants and animals. These rainforests are not only crucial for the health of ecosystems and life on Earth, but they're also known as the jewels of the Earth and the world's largest pharmacy because of their incredible biodiversity and the medicinal treasures they hold. These vibrant ecosystems boast over 80,000 plant species, many of which have been used by indigenous communities for centuries to treat various ailments. Interestingly, less than 1% of these rainforest plant species have been studied for their medicinal potential, highlighting the vast, untapped possibilities within these ecosystems. It's amazing to note that about 25% of modern Western medicines come from ingredients found in tropical rainforests. In this video, we'll introduce you to the 10 most widely used natural medicines that came from rainforest plants. 1. Quinine. Quinine was the first effective treatment for malaria and influenced the creation of tonic water, a popular beverage. Quinine comes from the bark of the cinchona tree. Indigenous South Americans first used it to treat fevers. In the 17th century, Jesuit missionaries brought it to Europe, where it gained global recognition. French scientists Pierre Pelletier and Joseph Caventou extracted quinine from the cinchona tree in 1820. The cinchona tree, native to the Andean forests in South America, particularly in countries like Peru, Ecuador, and Colombia, is known for its medicinal bark. This evergreen tree, part of the Rubiaceae family, can grow up to 15 meters tall and has glossy leaves and small, aromatic flowers. Indigenous people in South America historically used the bark to treat fevers, which led to the widespread use of quinine around the world. 2. Aspirin. Aspirin is widely recognized for its multiple uses, including pain relief, anti-inflammatory purposes, and the prevention of heart attacks. As one of the most commonly used drugs globally, it has provided life-saving cardiovascular benefits. Synthesized in 1899, aspirin's development was inspired by salicylic acid, a compound found in willow trees. Willow trees, belonging to the Salix genus, are celebrated both for their beauty and their medicinal properties. These deciduous trees flourish in temperate regions, especially in wetlands and along riverbanks. They are easily identified by their slender, drooping branches, elongated leaves, and the yellow catkins that signal the arrival of spring. For centuries, cultures around the world have revered willow trees for their therapeutic value. The bark of the willow tree contains salicylic acid, the precursor to modern aspirin. 3. Cortisone. Cortisone is used to treat inflammation, allergies, and autoimmune diseases. It is also utilized in birth control. Derived from wild yams, cortisone was synthesized by Percy Julian in the 1940s, marking a breakthrough in steroid research. Wild yams, known scientifically as Dioscorea, are a type of tuberous plant found in various regions worldwide. They thrive in tropical and subtropical climates with well-drained soils and often exhibit climbing or sprawling growth habits. These plants have been used for centuries in traditional medicine to treat various ailments from digestive issues to menstrual discomfort. The tubers of wild yams are rich in compounds like diosgenin, which have been crucial in the synthesis of steroid hormones, including cortisone. 4. Novocaine and cocaine. Cocaine is used in limited medical settings as a local anesthetic, while Novocaine is widely utilized in dentistry. These drugs have revolutionized pain management during medical procedures. Cocaine was first isolated from the coca plant by German chemist Albert Niemann in 1860, and Novocaine was synthesized in 1905 as a safer alternative. The coca plant, known scientifically as Erythroxylum coca, is a perennial shrub native to the Andean region of South America. It thrives in tropical and subtropical climates in countries like Peru, Bolivia, and Colombia. The plant typically grows to a height of 1 to 3 meters and has broad, glossy leaves with distinct parallel veins. Coca also produces small, white flowers that develop into red or orange berries, adding to its ornamental appeal. For centuries, indigenous peoples have used coca leaves for their stimulant and medicinal properties. Chewing coca leaves or brewing them into tea provides mild stimulant effects, helping to alleviate fatigue, hunger, and altitude sickness. This practice remains widespread in Andean communities, where coca is regarded as a sacred and vital element of daily life. The transformative moment for the coca plant came in 1860 when cocaine was first isolated. This potent alkaloid revolutionized medicine by providing a powerful local anesthetic for surgical procedures. However, the addictive properties of cocaine led to significant social and health challenges, resulting in widespread regulation and control. 5. Tobacurine. Tobacurine is used as a muscle relaxant during surgeries, which helps improve surgical outcomes by making anesthesia safer. It was discovered in 1935 from the curare liana plant, which indigenous peoples used for hunting. The curare liana is native to the tropical regions of South America and has been used by indigenous communities for centuries. Its extracts, applied to arrow tips, were known for immobilizing prey during hunts, showcasing the deep knowledge and connection these communities have with their natural environment. The active compound, tobacurine, has revolutionized modern medicine. It significantly enhances surgical outcomes by enabling safer, more controlled anesthesia. 6. Neostigmine. Neostigmine has played a crucial role in neuromuscular therapy. It is commonly used to treat conditions like myasthenia gravis and glaucoma, while also improving muscle function. This medication, first developed in 1931, was inspired by the remarkable properties of the Calabar bean. The Calabar bean, native to West Africa, has been significant in traditional medicine and cultural rituals for centuries. Renowned for its strong physiological effects, it was often employed in tribal ceremonies or used as an ordeal poison to establish guilt or innocence. Physostigmine, the active compound in the bean, was discovered in the mid-19th century, sparking significant advancements in neuromuscular treatments. 7. Vincristine and vinblastine. Vincristine and vinblastine are vital drugs in chemotherapy, especially for cancers like leukemia, Hodgkin's lymphoma, and neuroblastoma. These medications have greatly increased survival rates for cancer patients, particularly children. Vinblastine was discovered in 1958, and vincristine followed in 1961, both isolated by Noble and Beer from the rosy periwinkle plant found in Madagascar. The rosy periwinkle, known scientifically as Catharanthus roseus, is a flowering plant native to Madagascar's rainforests. It's famous for its bright pink or white flowers and thrives in tropical climates with moist, well-drained soils. Aside from its beauty, the rosy periwinkle is highly valued in medicinal botany for its powerful alkaloid compounds, which have revolutionized cancer therapy. 8. Ephedrine. Ephedrine is primarily used to treat asthma, nasal congestion, and low blood pressure. It has played a significant role in respiratory and cardiovascular medicine. First isolated from ephedra plants in 1885 and later synthesized in 1920, ephedrine revolutionized these fields of treatment. The ephedra plant, also known as Mormon tea or mahuang, belongs to the ephedra genus, a group of hardy gymnosperm shrubs. Native to arid regions worldwide, including Asia, Europe, and North America, these plants are easily recognized by their jointed green stems and small, scale-like leaves. Thriving in dry, sandy soils where other plants struggle to survive, ephedra has a rich medicinal history. For thousands of years, ephedra has been a cornerstone of traditional Chinese medicine, valued for treating respiratory issues like asthma and bronchitis due to its stimulative and decongestant properties. The plant's active alkaloid, ephedrine, marked a breakthrough in addressing asthma, nasal congestion, and low blood pressure. However, despite its benefits, the use of ephedra in dietary supplements has been restricted in many countries, as its side effects, such as elevated heart rate and blood pressure, have raised concerns. 9. Taxol. Taxol is extensively used to treat breast, ovarian, and lung cancers, as well as Kaposi's sarcoma. This life-saving drug has become a cornerstone in cancer chemotherapy, saving countless lives worldwide. Discovered in 1962, Taxol was isolated in 1971 by Monroe Wall and Munsuk Wani from the bark of the Pacific yew tree. In the 1990s, scientists developed a semi-synthetic method to reduce the need for harvesting the yew tree. The Pacific yew tree, scientifically known as Taxus brevifolia, is a small evergreen conifer native to the Pacific Northwest of North America. These trees typically grow to heights of 10 to 15 meters and are characterized by their slow growth rate. They are notable for their thin, scaly bark and dark green lance-shaped leaves. Thriving in moist environments, the Pacific yew tree can also take the form of a shrub. One of its most remarkable features is its bark, which contains Taxol, a compound that revolutionized cancer treatment. Interestingly, the tree must be around 100 years old before its bark can be harvested. 10. Reserpine. Reserpine is commonly used to manage hypertension and psychosis, and it marked a significant milestone in the development of modern antihypertensive and antipsychotic therapies. First isolated in 1952, reserpine was derived from Indian snakeroot, a plant long utilized in Ayurvedic medicine. Indian snakeroot, scientifically known as Rauwolfia serpentina, is native to the Indian subcontinent and Southeast Asia. For centuries, this plant has been a staple in Ayurvedic treatments for various health issues, particularly high blood pressure and mental disorders. It is distinguished by its slender stems, glossy green leaves, and small white or pink flowers. The roots of Indian snakeroot contain reserpine, an alkaloid that proved essential in the development of modern medical treatments for hypertension and psychosis. However, careful use of Indian snakeroot is necessary, as it can cause side effects such as dizziness and gastrointestinal discomfort.